Welcome back to Houston Life. Movement disorders are neurological conditions, and they can cause abnormal movements in our bodies. They can impact so many people. They, in fact, do impact tens of millions of people in the United States.
Now, restless leg syndrome and Parkinson's disease are just two of these nervous system conditions that are part of what is a very large group of movement disorders. So to get a better understanding, I headed out to the Woodlands to chat with Memorial Hermann's movement disorder specialist, Dr. Nadia Hammoud, to learn more. The term movement disorder is broad and umbrellas a group of nervous system conditions. To get a better understanding, I headed to Memorial Hermann's Misha Neuroscience Centre in the Woodlands to catch up with Dr. Nadia Hammoud, who is a movement disorder specialist.
Movement disorders are neurological conditions, so we should start by saying that, that typically deal with abnormal movements. So very kind of simplistic way of describing them. There really are a myriad of movement disorders, dozens and dozens of diagnoses, but the more common ones that we see in our practices are going to be things like Parkinson's disease, essential tremor, restless leg syndrome, and some other varied conditions.
Okay. Well, restless leg, I think that's something that a lot of people seem to struggle with, and their partners, if you're having to share a bed with someone who has restless leg.
Sure.
I mean, that is something you come across a lot in your practice.
So restless legs is a phenomenon where patients experience an uncomfortable sensation, usually in the legs, that oftentimes produces this urge to move or stretch the legs. And so it happens when patients are resting, most commonly when they're trying to sleep. And in order to alleviate that discomfort, they'll get up and move. And so if you're doing this several times a night to try to relax and to sleep, that's obviously going to be disruptive for you and then your bed partner.
And sometimes you might think you have restless leg, because I think people talk about it a lot,
Sure.
but it might not be the case. So it's always important to touch base with your doctor and get it checked out.
Definitely. So it's a clinical diagnosis like most movement disorders, meaning there's not really a lab test or an imaging study that makes the diagnosis. It's based on what you're experiencing and kind of ruling out other conditions that might mimic restless legs, those being things like diabetic neuropathy or iron deficiency anemia.
So what is the best way to treat it?
Sure. If you've excluded underlying medical conditions, then there are a couple oral medications that we like to use. They range from anti-seizure medications to a class of medication called dopamine agonists. And in patients who are really refractory and cannot get relief from first-line medications, there's also opioids, which have their own implications. So it's really important to touch base with whoever your treating physician is going to be, make sure that the medications are working, and then proceed accordingly to find the right treatment option for you.
And another one of the movement disorders that you come across a lot in your practice, which is something I haven't really heard a lot about, is the essential tremor. Tell us about this.
Sure. So essential tremor is a condition in which patients experience involuntary shakiness. It is the most common cause of tremor, so we do see it quite a bit in our practice. And the tremor can happen really in any part of the body, but it tends to predominate in the hands. It can be symmetric or asymmetric. And because of how the tremor happens, usually when patients are using their hands, trying to grab for objects, holding objects, it has a lot of day-to-day implications.
And what is the treatment for essential tremors?
There are quite a few different categories of treatment. The first-line treatments are going to be with oral medications, and in that category, there are many different types of oral medications that we use. Commonly, we turn to medications called beta blockers, which are also used in cardiologic conditions, or other neurologic medications that are traditionally used to treat epilepsy. If you do not respond or can't tolerate oral medications, there are some non-invasive ways to address tremor. So we can concurrently use wearable devices, which in early stages or mild forms of essential tremor can be quite effective. And then there are things like injections with botulinum toxin. So the same toxin that we use to smooth wrinkles in the face can actually be effective in dampening the tremor severity. And if those solutions don't work, then there are surgical options that we can explore.
So when do we know it's the right time to visit our doctor to talk about maybe if we have an essential tremor?
So if the tremor starts bleeding into your day-to-day life, it's affecting your ability to work, do your hobbies, take care of yourself, or causing you some form of embarrassment, I think that's an appropriate time to seek evaluation.
And of course, there's a lot more to do with movement disorders. There's so many other categories. It's always good to check in with your doctor, but we can jump online. Memorial Hermann has some great resources there.
Yes.
And then some great doctors when it comes time to need to get things fixed.
We are more than happy to answer questions. A lot of this is exploratory. So movement disorders can be kind of complicated, and we're here to declutter what might be going on and give patients answers so that we can find the right solutions for them.
Some great information there. Memorial Hermann have a lot of resources online at memorialhermann.org/movement disorders, or you can give them a call, 713-704-7100.
Very helpful. All right, after the break, a look at what's coming up on tomorrow's show.
Yeah, Houston Life will be right back.